Hi, welcome back to video 56 of Staying Healthy in a COVID Epidemic. In this video, we are going to discuss about the vitamin D strategies, preventative strategies to keep healthy. There's more than 50,000 research publications available in the internet and a research database showing that vitamin D deficiency increases multiple diseases, what in scientific terms including we are called comorbidities, and indeed worsening of the outcomes or complication from existing many diseases, hundreds of diseases. The reason for that actually we discuss and as it actually helped not only the immune system as we discussed in the last video, but also improve the physiological functions of almost all the body systems in the body. That's what the nature has designed, and we should exploit that to our benefit to keep it healthy with a minimal or no cost. So let me give some definition so that you understand and rely on rather than carrying away by some of the myths produced by the videos and various pharmaceutical and propaganda websites, which are unfortunately incorrect. So having serum 25 hydroxy vitamin D concentration, that's what the laboratory should measure. That's the only thing laboratory should measure, nothing else. Sometimes they do other things so that they can take extra money from you. Don't allow them to do that. Make sure that they only do the 25 hydroxy vitamin D concentration. If this is less than 20 nanograms a mil, in some countries use the nanomoles, so that's equivalent to 50 nanomoles per liter, is considered globally as a hypovitaminosis D, less vitamin D. So which is generally is considered as unhealthy. Such levels will impair the function of many of the enzymes and physiological function, and indeed even the generation of energy within our mitochondria, our powerhouse in the body. So vitamin D insufficiency is defined by having the vitamin D levels between 21 and 29 nanograms per mil. But as I said, it's increased the vulnerability to many diseases, disorders, infection, immune function, and indeed worsening the existing chronic diseases in particular. Based on more than 25,000 research publications, it's in the internet, you can watch and go to a website or research data website like nih.gov or PubMed, for example. You can read them free. And these all consistently show that having a physiological level of vitamin D, such as about 30 nanograms per mil, will reduce the incidence and the severity of diseases like gastrointestinal abnormalities, metabolic disturbances, or pregnancy-associated complications, a very important area, and also obesity. So, nevertheless, some areas I'll mention in a minute that need to have a higher level of vitamin D, such as 40 nanograms per mil, as in the case of COVID-19. So, studies have shown that concentration of vitamin D, 25 hydroxy D concentration under 12 is only sufficient for musculoskeletal diseases to prevention of rickets and osteomalacia in adults, nothing else. So unfortunately, based on that data, the United States government appointed Institute of Medicine, which is really not a research organization whatsoever, it's a selected few people, recommended that having 29 nanograms per mil is adequate. Yes, it is adequate, but only for the musculoskeletal system. And none other systems get benefited with such a low level of vitamin D. And indeed, you have to remember that Institute of Medicine report is not a public health guideline. It is a recommendation to the government to make the guideline. But government, unfortunately, did not take any consideration of these and used that as an unofficial guideline, which very unfortunately copied by almost all the countries in the world and used this erroneously low level of recommended by the by the Institute of Medicine, which is really a disservice for the world, which I would, in simple terms. So the levels at such low level, like less than 20 or less than 30 actually, have a very little beneficial effects on prevention of key medical disorders, particularly autoimmune disorder, like it could be thyroid, lupus, or any other autoimmune disorder, heart diseases, cancer, and indeed all-cause mortality. People with a low vitamin D die almost 10 years, 8 to 10 years earlier than otherwise. So why would you die 10 years early when you can go out on the daily basis and get some fresh air and vitamin D and stay healthy and avoid doctors and avoid going to hospital? Isn't that a good thing to do? Which is free for you. Rather than staying indoors and having the low vitamin D, all your earnings are then wasted in hospital visits and for doctors. So you can avoid these by having a healthier life, physical activity, good nutrition, especially micronutrients, and then having the vitamin D to increase your immune system. The two key strategies that can be implemented on a focused food supplementation program, particularly the fortification program, and encouraging the public to have a safe sun exposure. It is the government's responsibility to advocate this. I'm yet to see any government publicly advocating food fortification program for companies to come up with. Right now, they are all voluntarily, and therefore many are not doing so, and the safe sun exposure. For your benefit, the cost of supplementing micronutrient into fortified food, staple food, actually increase the cost by 2 cents per person per day. But it can prevent the diseases and reduce millions of dollars for the government. Yet some reason or other, this simple mathematics, no one doesn't seem to be want to know. The next point I like to discuss is actually the one size does not fit all when you come to nutrients, some of the nutrients like vitamin D. So different body systems require the different levels of serum 25-hydroxyvitamin D. This is very few people in the world understand this, and I don't know why, but it's very clear from the published data of 20,000 publications show that muscular cell system only need the 20 nanograms per ml, but the general infection and the metabolic function need more than 30, and for cancer prevention, cardiovascular and viral disease prevention, particularly the COVID-19 required more than 40 nanograms per ml in the blood. So be mindful of these numbers, because depending on the situation, you need to get less or more supplementation or stay in the sunshine a little longer. So let's, however, the prevention of cancer, as I said, cardiovascular disease, autoimmune disease, bacterial infection like tuberculosis and leprosy, all required a higher concentration of vitamin D. The Institute of Medicine recommended 20 nanograms per ml. It does not even touch those disorders. So it's really a disservice, as I previously mentioned. So let's that's relying on the serum 25-hydroxy concentration 20 as recommended by some of the European government and scientific society is misleading and harmful. It's a flawed concept. So as I mentioned, it is important to note that these other diseases you might have or want to prevent it, going to need concentration of serum 25-hydroxyvitamin D in the range of 40 to 60 nanograms per milliliter, to a little bit of higher end. This can be achieved definitely achieved by sun exposure. Very much easy to get through the supplementation, like 4 to 10,000 international units taken on a daily basis, or at least take the 50,000 unit once a week or every other week for a few weeks, and decrease the dose to 50,000 units international unit every other week for a longer term duration. This is very much safe thing to do. Serum 25 hydroxy vitamin D up to 100 to 125 milligrams are absolutely safe. There's no evidence whatsoever in the world to show that that kind of level, higher level, causes any health abnormality at all. No toxicity develops until the serum 25 hydroxy vitamin D level reaches above 150 nanograms per ml, which is equivalent to 375 nanomoles per liter. Interestingly, this is achieved only if one consuming in excess of 40,000 international units of vitamin D on a daily basis for more than 12 to 18 months on a daily basis. But no one I know recommending such pharmacological doses for any reasons, except that there's one or two very rare diseases, what we call the vitamin D resistant rickets, for example. Those patients need this kind of high dose on a daily basis because there's a genetic abnormality that they need to overcome to save their lives. So let's just summarize that examples of benefits of vitamin D include reducing the multiple health risks, and thus reduction of the incidence of obesity and diabetes, metabolic syndrome, multiple sclerosis, very important thing, rheumatoid arthritis, osteoporosis, and certain type of cancers, particularly breast, colon, prostate, and head and neck cancers will be reduced by almost 50% if you prophylactically raise your level above 40 nanograms per ml. And it also reduces all-cause mortality. You will not die early because of the metabolic abnormalities. So in the next video, I'm going to discuss about the cost-effective ways to produce the micronutrients, which is extremely cheap to do to the communities and even the countries via food fortification program, which, as I mentioned before, only adds but the 2 cents per person to keep healthy. Till then, thank you for participation. This is Professor Sunil Wimalawansa. I'm Professor of Medicine from New Jersey, United States of America. Please do not hesitate to subscribe to this channel by pressing that red tab, which is free for you. Thank you, and till then,